Good morning, Mrs. Brown. My name's Tori and I'm here with the respiratory department. I'm here to visit you today because your doctor has ordered some positive airway pressure therapy, and we're going to use that to help open up those lungs so you can get those secretions coughed out and breathe a little bit more easily. Is that okay? Alright, so I'm just going to have you go ahead and set up for me. And we're going to use this device that's called an EZpap. So what it's going to do is you're going to take a normal breath in and then a little bit more forceful breath out, and it's going to create a pressure that you're going to feel, and that's going to help to open up those airways, okay? Kind of pop open those alveoli, those little air sacs at the end of your lungs, and that's going to help you to get rid of that atelectasis is what we call it, and that's what happens when those get kind of floppy and they don't fill with air like they're supposed to. So by doing this, we're going to be able to help you to breathe a little bit more easily, okay? So I just kind of want to talk you through the process before we get started so you have the opportunity to ask any questions if you have questions or concerns, okay? So I just want to show this to you. So this is the device that we're going to use. This is the EZpap. So this is what you're going to put in your mouth, and you're just going to seal it tightly around there, okay? Now I'm going to hook this up to the air source, and that's what's going to start, that's what's going to help with the pressure. So the pressure from there is actually going to be multiplied in this device, which is going to form that positive airway pressure for you, okay? Now, if we needed to ever add a nebulizer treatment to help open the airways, we would just attach that on this side. But for today, we don't need that. We're just using this to help open those up for you, okay? So this is attached to the air source, and then I'm gonna put a pressure gauge. Looks like this. I'm gonna put this on the bottom because I want you to get between that 10 and 20, so where that's green, we want you to get in there. So I'm gonna mark that with this little rubber piece so that we can make sure that you're getting the appropriate amount of water pressure from your treatment, okay? So do you have any questions for me about how this is gonna work? Okay, are you ready to begin your treatment? It'll last about 10 minutes. Okay, so we'll go ahead and have you do that. Just take a nice breath in and then a strong breath out, okay? Breathe out as much as you can so you can get all that pressure. Okay, now that our treatment's done, I'm gonna have you cough for me, see if you can cough up any of that mucus. Alright, now I just need to listen to your breath sounds again. And I'm going to get your vital signs also. Now I should have done that at the beginning of your treatment, and I'm going to do it again here at the end. That way I can compare and see if this treatment is working for you. Are there any questions about what we did today? Alright, if you decide that you do have a question later on, please feel free to ask. Thank you very much. Have a good day.